Range of motion test elbow flexion. Partner will be laying supine, arm should be to their side and forearm neutral. Face cradle is placed under the elbow. Axis of rotation is lateral epicondyle of humerus. Stationary arm is aligned with the lateral midline of humerus. Mobile arm is aligned with the radius and radial styloid process. The partner proceeds to flex their elbow. Normal range of motion is 145 degrees, with the partner displaying 141 degrees of elbow flexion. Manual muscle test posterior deltoid. The partner will be laying prone with shoulder on edge of the mat at 90 degrees of abduction with elbow flexion. The posterior deltoid originates at the spine of the scapula and inserts into the deltoid tuberosity. The actions it performs are extension at the glenohumeral joint as well as horizontal abduction, which is pictured here at the glenohumeral joint. The motion occurs in the transverse plane. I will apply pressure downwards while the patient is instructed to push against the resistance. The patient is given a 5 as a grade because she held the position against resistance. Range of motion test cervical extension. Head will be in neutral position. Axis of rotation is the external acoustic meatus. Stationary arm is perpendicular to the floor. Mobile arm is aligned with the nares or bottom of the nose. The partner will proceed to extend their neck. And normal range of motion is 60 degrees, with the partner displaying 55 degrees of cervical extension. Manual muscle test upper trapezius. Partner will be sitting down with arms at her sides. Origin of the upper fibrous is the external occipital protuberance, occipital bone, ligamentum nuchae, and spinous process of C1 and C7 vertebrae. The insertion is the lateral end of the clavicle, acromion, and spine of scapula. The actions are scapular elevation, as seen here, upward rotation, and lateral flexion and contralateral rotation of the neck. Motion occurs at the frontal plane. The partner will be instructed to shrug her shoulders as I apply pressure downward. The partner was given a grade of 5 as she kept the position with resistance. Range of motion test, hip external rotation. Partner will be sitting with legs bent and dangling off the mat. Axis of rotation is the anterior patella, while the stationary arm is perpendicular to the floor and the mobile arm is aligned with the anterior crest of the tibia. Partner will then be instructed to move their foot medially as far as they can go, which causes external rotation at the hip. Normal range of motion for hip external rotation is 45 degrees, with the partner displaying 35. Manual muscle test hamstrings. Partner will be lying prone with knee flexed at 90 degrees. In order to target the medial side, the muscle semimembranosus and semitendinosus, I will have to medially rotate the foot of the partner. The muscles originate at the ischial tuberosity and insert at the medial tibia, and their action is hip extension, knee flexion, which is shown in the video and occurs in the sagittal plane, and knee internal rotation. I apply pressure downward as the partner resists the motion. In order to target the biceps femoris, which is on the lateral side, I will have to laterally rotate the partner's foot. The biceps femoris originates from the ischial tuberosity, linea aspera, and posterior distal shaft of femur, and inserts into the head of the fibula, lateral condyle of the tibia, and does hip extension, knee flexion, and external rotation. The partner is given a 5 grade as she is able to hold the movement with resistance.